Hi, thanks for inviting me. First of all, I clarify, I live in the US. And actually, at the end, I have a new coronavirus symptom checker launched in China already, and I'll give you a briefing about it as well. Okay. So we have done a lot of work on the clinical level AI problems. And here is a summary of what we have. You know, as a human being, we are very unfortunate. 85% of the diseases we have cannot be cured, can only be treated. That's a fact. And so we actually, in Tencent, and we target many of those chronic problems. And here, I give a few here, like psoriasis. Psoriasis, and in China, there are about 8 million patients. So far, there's no cure, and they come back once in a while. And Parkinson's is one of the very, we call it debilitating disease more than cancer, because a normal human being, a Parkinson's patient, have a normal life cycle, but probably 1/3 of their life cycle, they are no longer independent. Also cancer, also the stroke problems. So here, there are a few demos here. Just want to play the slides again so you can see it. So the one for the Parkinson's, if there are doctors in neurology, I think the major challenge is to evaluate the motor function of a patient. And these days, in the entire world, every patient will take doctor half an hour to 40 minutes to evaluate. The patient will perform different motor functions, such as finger tapping, like the one you see here. That's a UK patient. And alternating your fist and gait analysis as well. All these are very time-consuming. Right now, they can only be done in a clinic by a doctor, by a clinician. Cannot be done yet before our technology with the metal pad in a home setting. So in a home setting, when the patient take a medication, such as the metal pad from Roche, and some patients, their motor function will improve very quickly in the first 1 hour. In the rest of the day, their motor function probably will remain bad again. Right now, the clinic have no idea what's happening in the home setting. Everything based on the doctor, the patients, with their family member going back to see the doctor, tell the doctor verbally. Then doctor will probably change the drug or eaten the dosage. Everything's based on you see your doctor. That's too much money. I talked to a famous doctor in China, in Shanghai, and he told me, if you can reduce the visit of this doctor's patients to me by 50%, you solve the traffic problem near my hospital. And here, there are also other things like psoriasis, and the pre-diagnosis are very difficult. Also for psoriasis, because there is something called PASI score to evaluate how effective it is for the medication. As well, the evaluation take doctor half an hour to 40 minutes. And we also have a demo, so patients can do everything in the home setting, and for both pre-diagnosis as well as for evaluation on the PASI score. So in the lab, we have the fundamental technology touching almost every aspect of medical data, from natural language processing to knowledge graph, to images, to videos, to EKG, EEG, as long as you can imagine. And I think the previous speaker mentioned about, for AI to be, explainable, we actually not only use deep learning, we are using Bayesian network. Bayesian network give you the evidence of the symptoms, treatment with the diseases. So here is, I'll just give you, this is Michael J. Fox. And people here probably all know he has Parkinson's. And these are his movie clip from the 80s. I think it's called Back to the Future. Let me play it again. Can you tell the way he walks is funny? Yeah, unless you are a trained neurologist, you probably couldn't tell. But actually, if you are a PD neurologist, you look at the way he walks from when he's still young, the way his gaits are different from a normal human being, from people without PD. These are some analysis. So we look at the video without having a sensor at all on the subject. Everything is video-based. Then actually the way he walks, the way he swings the left arm, both the frequency, also amplitude, are not normal. It's different from a normal human being. If you look at his movie, he always put his left hand in his pocket. I think he knows it. Subconsciously tries to hide it to look cool. So we can right now examine, do the motor analysis, not only in Parkinson's, but also multiple sclerosis, cerebral palsy, scoliosis, only on video-based approach, without a patient or any sensor, and that's very important. If you've been to a gait lab, I've been to the gait lab in Hong Kong University, and when they evaluate the motor function, the gait of a cerebral palsy patient, they wear 128 sensors. That's ridiculous. And you have to keep a big room, with also infrared cameras around it. They walk. You have 2 librarians to check the data. Every subject takes half a day. You do the math. You tell me how much it is. It's very expensive. And now this can all be done by AI using videos. So these are some additional biomarker work. We are working with MedPad. It's my longtime collaborator in London. And for the motor disorder, we using a video analysis as well as using the sensors in the cell phone to predict arthritis, osteoporosis, and organ transplant problem for neurology, as I mentioned, for Parkinson's, for multiple sclerosis, and also as well as other digital biomarkers for heart failure and for atrial fibrillation as well. And there are a few demos coming up as well. And we are treating everything seriously, and we are filing, treating everything as a device, filing FDA in the US and NMPA in China. These are some of this additional work based on the cell phones. So, traditionally, when you're examining the motor function of a patient, because in the old school of medicine, there's no AI yet, all right? So everything based on evidence-based medication, evidence-based medicine. Now we have a cell phone. So many of the motor function you can actually evaluate by putting the cell phone in your hand, or just put it in your pocket. So that will record your motor function, your gait, as well as how effective it is for a medication before or after you're taking that. So the one below that shows you what we did with Roche. So these are some of our Parkinson's evaluation we did with Roche Pharma in China. And so we have altogether launched in 15 hospitals in China, and with more than 300 patients. And so this, in the bottom left, there are the In Parkinson's, there are four levels of severity, either 1, 2, 3, 4. And those charts on the left are the motor function before taking Medopar. And then the right are their motor function after taking Medopar. And all these are calculated using AI, using video analysis, without a doctor to look at it. When a doctor look at it, they can only give you a score. They wouldn't be able to give you the frequency, the amplitude. But all this can be done by AI, and it's also repeatable. And for the motor function evaluations, not only time-consuming, but I did that test in London with King's College, also in Hong Kong, in China. Street doctor look at the same patient. They do not give the same prediction. Because humans are subjective. You tell them, how stable it is when you do the finger tapping. Depending on the mood of your day, on your eyesight of the day, it can be different. So, but the AI is objective, it's repeatable. And these are very important for clinicians, for diagnosis, also for treating patients as well. And these are some additional work we have done in HKU on scoliosis. Scoliosis is the problem with the spine. It happens when the children are growing up. The current diagnosis is, in Hong Kong, every kid gets screened once or twice a year. They get naked in the top part. The doctor will look at their shoulder, their back, they bend down, they look at how uneven it is. If they look suspicious, they send them back to the hospital, they use the machine, they scan it, they look at, like the tree ring, how uneven or uneven it is. But right now, we have used AI just to look at the way they walk. And we found some very interesting biomarkers, such as there's one called the Crombin pelvis angle. And the subject, also the patient, is different. It's pretty significant. So this one, we are now sending a paper to the Scoliosis Research Society for publication, also doing a larger trial in mainland China, in the US as well. And hopefully, it will be a much more efficient, cheaper way for doctor to pre-diagnose scoliosis patients to help the kids. And these are some additional ones. We are working on EKG. EKG, some of the disease, like atrial fibrillation, it's very hard to diagnose in the clinic. You need a long time monitoring device for that. And we have this deep learning-based approach as well as signal processing-based approach. And on the benchmark data set, the EC57 from MIT, our F1 score is 95%. If you talk to a EKG expert in the hospital, they are typically between 70 and 80. So we are now working, making it available to a heart sticker. You wear it, a heart sticker, or even a watch, then can give you the diagnosis.
ECG monitoring with wearable ECG device is the best way to detect these diseases. With the huge amount of data that comes with long-term monitoring, efficient data processing with high performance is what you need. The medical AI lab of Tencent is introducing Tencent ECG Analysis Cloud Service to help you master the processing of long-term ECG data and accompanying every beat of your heart.
Yeah, these are some of our smartphone PPG-based approach, the photo plethysmogram. And we just actually have one now in a trial to use PPG on smartphone to monitor your blood oxygen level, which is very important in in-home monitoring of the new coronavirus patients. Because in China right now, we have such a big number of suspicious patients. They cannot be taken care of by the doctor. So you need something cheaper available in the home setting. So yeah, this one is here. Yeah, I did this yesterday in my hotel. Yeah, you have somebody want to try, come to me at the talk. I have it on my cell phone. You just put your finger on the camera of my iPhone. Then within half a minute, it will measure your blood oxygen level, also your heartbeat. Because the blood oxygen level is very important to determine if the lung have a problem. Because the new coronavirus, the symptoms are very similar to a common cold or flu. And so the patients cannot be taken care of by every suspicious patients. It's very hard to be taken care of by the doctor because you don't have that many doctors available. So after like half a minute, that's one from yesterday after I went to the gym in the hotel. So my oxygen was 98 and my heart rate was 64. And those are done by using the cell phone. And these are psoriasis. Psoriasis actually is a common problem among in the entire world. People with different skin color all have this problem. And we have developed the pre-diagnosis, also the PASI score evaluation. Here's a demo. There should be some sound, actually, that didn't come out. Yeah, you pick the, after the image, and upload the image, as well as the chatbot will ask additional questions that will give a pre-diagnosis about how likelihood and the patient have psoriasis or something else.
Of induration, the lesion area ratio level, and an overall rating. This type of ratings makes it easier to track lesion severity trends for psoriasis patients. Finally, we provide a result feedback channel to improve our model by user feedbacks.
Yeah, these are some of our heart failure work, and we launched a digital therapeutic platform with Novartis last year in China, and in China we have up to about 19 million heart failure patients. And heart failure patients, I think the major problem is you want them to stay away from the hospital because I think in China we have every patient, they are back 2.5 times a year. I think in the UK it's about 3 times a year. And also for any hospital, they have one KPI is you don't want your patient to come back within 30 days because that will damage your KPI. That's a fact. Same thing everywhere. So the problem is for heart failure patients, they have to comply by taking the drug. Also, they have all types of questions about the disease, about their living habit. For every chronic patients, I think the major demand is they want to live like a normal human being. So we have a chatbot providing this. So these are, I'll give you a quick demo here. Yeah, these are in Chinese, but I can do the best to translate. Yeah, here are putting some important bioinformation databases, such as the blood pressure, your weight, and your heart rate. Then ask you some golden question like you have a problem breathing. Then when the patient answers the question, give a prediction about the risk the patient deteriorates. If they do deteriorate, Then we are also giving information about clinics nearby, and the patients can go and visit to get checked, and before they are getting worse, get readmitted. And these are some chatbot.
我吃药大半年了，感觉好多了。
So yeah,
能不能停药？
that was my voice. So my question is, I have taken medication for over half a year,
切记不要在
and
未
my
经医生同意的情况
symptoms
下
are
自行停止
gone and I feel normal. And can I stop taking that? And the right answer, you shouldn't. So yeah, here there is information. And I also ask, I have a heart failure. Besides medication, can I have a surgery? And I give you some answers from KOLs in the field, telling you about all the options. Then you click on that link. There also we have the patient education, the videos. These are shot by famous doctors in China or elsewhere, giving the right information to patients so they know they are taken care of, right? I just you can ask also all kinds of questions, can I take black tea? Or this one, I did it in last November in Shanghai. In November in Shanghai, the typical food is the hairy crab. So, can I eat hairy crab? Then the chatbot will tell you, and what you should be careful about, all the kind of things. Or can I exercise? If you are knee-high too, then you can do some yoga or some simple ones, and all the kind of things can answer that. Yeah, so these are these are some pictures we take with Novartis pharma CEO with Marie-France Choudin, earlier this year. Yeah, anyways, okay. So yeah, so since I work in a Chinese company, so we have the obligation to screen people in China on the new coronavirus pneumonia. So we launched actually 2 days ago. So on the first day, in a single day, we have the UV, what called unique visitor of 150,000. And in the first day, and 97% of those patients, people who will use it, finish it. They want to make sure they either have something or don't have something. If they don't have it, then we'll tell you, what you should do to take care of yourself. And if you have some symptom but not dangerous, but there are something you should watch out for before you bother see your doctor, right? Because you don't want to have an influx toward the hospitals. And if you're looking very dangerous, then you should go, right? So here's a demo here. Yeah, these are. Yeah, it's in Chinese, but you'll see it translations in. So we are making the English version available, and looking forward to making it available elsewhere in the entire world, because epidemic is epidemic. And it's our problem, it's our obligation to help each other to solve the problem ASAP. Yeah, so this one is you should have a timely consultation with a doctor, and then there are a lot of patient educations, Because people in China, they are a little bit now overly loaded information. So I think the most important after a while is, do I have it? Or if I don't have it? If I don't have it, how to prevent me from having that, right? If I have something looks suspicious, then what to watch out for? And if I do look like I have something, so what's my next steps, right? These are, the most important, even during epidemic, you want to live like a normal human being. That's human nature, right? So as internet company, we can do a lot to help patients, also helping doctors, government to solve this problem, okay? Yeah, I think that's the end of my talk. And so I'm glad to be in UK again. I come here a lot. I treat London as my first hometown. And I was here last time in November, Thanksgiving with my family. And so that's my vision with my longtime friend, the MetaPath CEO, Dan Vadat. I think our vision is I want to live long and healthy and spend more time with our loved ones. Thank you so much.
Thank you very much, Dr. Fan. Thank you. That's fascinating. And who knew about Michael J. Fox, the gay? That's a fascinating insight in itself. Unfortunately,
we shoot the video. I wouldn't tell. We look at the videos from famous people, in the entire world. We know they have something.
Yeah.
Even that look at the way they walk.
It's incredible, isn't it? Incredible.
Yeah, the way they
insights.
walk, also the way you talk, also your facial expression says a lot about you. All these can be done by AI because traditionally it relies on your doctor to pre-screen you and how many doctors you have. You have a lot in the UK, but you wouldn't have a doctor next to you. Yeah.
I think
so. Yeah,
some of us
tremendously. So my dream is like, we get together just to transform our life path, live long and healthy with your loved ones.
Absolutely.
Yeah.
You have got some of us scared, but we are going to let you go. So please give a round of applause, please, to Dr. Fan. Thank you.